Okay, we are progressing through our Fundamentals of Therapeutic Massage textbook. And we are on chapter 13 in our final unit. And this one is going to give you an overview of the various settings where massage therapy is provided that would then influence a career pathway and what you can expect with that. And then the chapter after that is population focused, from massage for animals and athletes to people with stress disorders, pre and postnatal, children, geriatrics, etc. How do we adapt? How do we adapt based on some general principles around each of those populations? Wellness education is chapter 15, which involves generalized information related to nutrition, to exercise, and importantly, the body-mind connection and the idea of good coping strategies and resilience. And then the very important final chapter, chapter 16, with all of the different case studies, which puts information together. So some of the populations that we talk about in chapter 14 are more likely to be seen in a specific practice setting. And so it's beneficial to describe those first before we get into the individuals. So here we go. Ta-da! Now we have already looked at this a little bit, and this is part of this scaffolding idea and the spiral nature of the content in the textbook. So other chapters that would support this information, and you're going to want to go back and look at, is particularly Unit 1. Chapters 1, 2, 3, and to a lesser extent, chapter 4. And you'll start to see the overlap between the content here. So if you're following through this textbook sequentially, which we are at Health Enrichment Center, that content was originally presented at more of the beginning of your learning journey. And now we're more at the end of your learning journey. And this is going to have different meaning to you than it did back then. So let's start. So these are the main settings we're going to take a look at: health and wellness, spa franchise, non-medical setting, still therapeutic massage, still focusing on therapeutic outcomes, but not under the medical umbrella necessarily. I mean, there's a crossover in there with a medical spa. All right, now, then we have the medical care environment. And we actually have spas within the medical system, but there's an overarching theme there that you behave differently, you interface with different people, different occupations between the health and wellness centers and the medical care centers. And then we have the sport and fitness environment that has its own professionals that we work with, that has a unique practice parameters, and also crosses over with both the health and wellness recovery restoration center type area and medical treatment, if special, like if there has been a sports injury. So here are our chapter objectives, and here are our key terms. And often these categorizations, in order to develop a level of presenting information, chunking it, um, look like they're put in specific boxes, but it's not. This is just as intertwined as everything else. I just got done doing this video for a video like this for our essential science text, and it was chapter 11. And integument, circulatory system, lymphatic system, and immunity. And it was difficult to try to isolate information to a particular system because they all are intertwined. You can't address an artery without also being in the physical location of a vein, which is going to be at some point surrounded by capillaries, and the lymphatic system. It's just, it boggles my mind in the attempt to try to say, okay, this, right, so the artery comes down and it gets smaller and smaller and smaller and smaller and smaller, and then it eventually gets down to this one-celled capillary, and then something happens there, and then it goes back up another tube called a vein. It just doesn't happen like that. But we have to have concepts. We have to simplify things a little bit in order for us to be able to, especially in our initial phases of learning, kind of get a framework to think from. So that's what this is. It's a framework. It's not set in stone, and I try to discuss that down here. One of the bullets here says, scar tissue management for cosmetic surgery may be combined with general full body massage in a medical spa. This appears to be the case of a use of a clinical medical massage, but it takes place in the spa setting. So restorative massage with essential oils and soft music and lighting may be provided to support relaxation and sleep for the athlete after a competition. This appears to be focused but it's be spa focused. I can't read it. Spa focused, but this is being delivered in a sport and fitness setting. So I'm going to try to not bumble too much through this. And I'm going to bring the font up a little bit so I can see it a little bit better. And so here we go. Okay. So the general description here of a spa is it's an environment that is extremely varied. Lots of times people go, oh, I just work in a spa, or you just work in a spa. Oh, very rich environment with a very specific body of knowledge. It's truly a specialization. And so don't ever discount this environment. This is where massage thrives, is in this type of a health and wellness setting. So these are also places where people seek massage for their for non-medical outcomes and can self-select They don't have to rely on a prescription. So medical care, there is an assumption that there's some sort of pathology present and it's being treated. Now, there is the idea of preventative medicine. But when we go and get even our yearly physical, the tests and stuff that are run, they're looking for what's wrong and to correct it early, and that's a very good thing. And we want to do that. But mostly massage is in the medical care structure is not part of prevention. It's part of an integrated or interdisciplinary team for a condition management situation or a rehab situation, which would be considered more of a therapeutic change idea. And just like up in the spa setting where we interface with highly trained professionals, the cosmetologists and the estheticians and the personal trainers and the yoga teachers and all of the other consultants and service professionals that are practicing in those rich environments. We have a similar thing down here in medical care, and we've got, but there's quite a hierarchy here. There is the doctor, and then there are a series of paraprofessionals underneath, or professionals and paraprofessionals underneath that. So you've got physicians from the doctor, you have the physician's assistant, and then you might have a tier of professionals like a physical therapist and an occupational therapist and nutritionist and a rehab specialist. You've got your whole nursing hierarchy there, your PhD nurses, your nurse practitioners, and based on education and experience, down to your certified nursing assistants, your CNAs. And often massage therapy is in the medical settings, especially acute care settings, it is the nursing staff that we most often work with. And then in sport and fitness, now we've got performance demand. While not specifically a pathology, there is strain on adaptive capacity to be able to throw a ball or swing a club or run up and down a field, or and there's a potential for more musculoskeletal joint injury and wear and tear. Whereas in the medical care, unless you're in physical rehab, but if you're in acute care or in pain management, these are typically not specifically related to muscles, joints, bones. Even though the joint might be a driver of a pain sensation. The focus is on the pain as opposed to the function of the joint. Whereas in the sport and fitness world, it's performance demand, and so the function has to be a certain way, and it can't hurt either because that interferes with the function. So we're working with athletic trainers and coaches and potentially personal trainers if you're outside of the professional sports or collegiate force arena. This overlaps a lot of times up into the wellness care as we are looking at exercise for health maintenance or health enhancement. So round and around and around we go. But there are some distinctions that we can take a look at. So the first topic is health and wellness. And here are the the whole chapter objectives that we'll be addressing here and how we specifically are going to look at it in the section devoted to this. There's a lot of confusion here, and this is where terminology becomes important because it helps us understand where we are, how the management, how the umbrella of the business is constructed. And this is also where sole proprietorship lives. A autonomous practice by yourself is in this arena, and it may not fit specifically in with the all of the other amenities and other facilities and other service offerings that a large spa might be able to offer. It's still, that is where sole proprietorship, massage therapy, own practice lives, is there. So a lot of the confusion is the rise of the massage therapy franchises. And as you know, Health Enrichment Center in the same building, which our family owns, as the school, is a franchise. And you have had or will be having an opportunity to job shadow there so that you can get an idea of how this type of a business structure is organized and managed. This is a fairly new concept, 2000, early 2000s, and has continued to grow all these years. It has a spa flavor to it, but typically the franchise doesn't have all of the service offerings that you would have in a large spa. The spa traditionally is, and historically has been seen as a healing center. There's confusion there too. It's not focused on, classically, it's not focused on beauty. That would be a salon. But they've gotten mixed up so that you have appearance-related services combined with health promotion, health maintenance services. But they were very different way back when. So the rise of the franchises is it's a business model, and sometimes people will inappropriately call these chains. A chain is something very different. You can find chains in the spa. So a chain is where one business entity, typically a corporate entity, but it can be even sole proprietorship, owns and or manages multiple locations. Chains are common with restaurants. So if you can have a family restaurant, and they can have, they've gotten quite successful, and so they open another location and then another location and then another location, but it's all managed by the same entity. A franchise is a single owner business, or a person can own multiple locations. but it's run like a sole proprietor business, local business owners, and they buy access to the brand. So the franchisor has had a successful business or developed a successful business model. Maybe it started out as a chain, like we described with a restaurant, but it got big enough, or the expansion, there was a desirable expansion to the point where they said, we have a good business model. Let's sell the model to other people and help them open a business and be successful. So now that person that started with their own, we were talking about restaurants, their own restaurant, and then it developed into a chain with multiple locations. Now maybe it can also develop into a franchise where the original developer really doesn't have a lot of control other than around the brand and the brand name and how the services are presented in a certain way. But they don't take care of any of the daily operations or anything like that. It's a supportive network. Still lingering, unfortunately, is a misunderstanding about the franchise and a sense of threat to sole proprietorship. And that really shouldn't be the case. They're very different. And it's opened a wonderful opportunity for massage therapists to move into their career pathway as an employee. And back in the business chapter, chapter 3, we talk about that in depth. So this is a really important development and providing options for where a massage therapist can evolve their career. So if we're going to work in this multi-dimensional environment, then we have to broaden our knowledge about that environment, what services other than massage therapy are offered, how we internally refer back and forth. Sometimes there's some retail involved in this environment. So this section right here is giving you an overview of that. And we just got done with chapter 12. And a lot of the adjuncts and the what's called the complementary bodywork methods, including the culturally based systems, are often found incorporated into the massage session, or multiple professionals where the person that's in the environment can choose various approaches. So we go on here because it's such a rich history in the spa, and we give you a little bit of oversight into that. The idea of what is a brand image. Now, we talked about that back in the business chapter. If you really want to get an overview of what this environment is like, and I was very impressed with this organization during the COVID pandemic because they were right on top of it. Boy, it's iSpa, International Association of Spa, iSpa. Great organization. And I think the link is somewhere here in the chapter. They rallied together immediately on the adaptations for all of the sanitation and all of that, way faster and way more thoroughly than the massage community did. It was really impressive. So that this wellness industry can be very nimble and it can be very entrepreneurial. So as you read through this, hopefully you're going to get a little bit of a overview of this environment and the things that are a little unique in that, such as the retail, for example. A medical spa typically has to do with creating a spa type environment with all of the uniquenesses of the spa world, with the adjuncts and complementary services, and it also overarches into some medical type procedures like bariatric surgeries or cosmetic surgeries. So it's nice to see the blending that's happening here. Mayo Clinic, under the direction of Dr. Brent Bauer, in its integrative medicine system, has created a spa and so that speaks, I think, to the importance of the spa concept, the spa industry, the spa history as a healing center. And massage is very much integrated in this world. So this just goes on to give you, these are some of the medical procedures that you might find, cosmetic procedures that you might find in a medical type spa. Because of the confusion around spas, because this is also, unfortunately, where we still have the cover for prostitution and connection with the sex trade, unfortunately, human trafficking. That group has used the word spa, and so many of the spas now, in order to remove themselves from that, are dropping the word spa and using the term integrative health and wellness centers. So it's very sad. It's very unfortunate that it has evolved that way. So there's protocols around safety and sanitation. And many times, because a spa has a robust hydrotherapy system, there is a lot of health department oversight, and then depending on the client and if they're considered a medical spa and if there is exchange of third-party insurance coverage, then the spa environment may or may not be under the requirements of the Health Insurance Portability and Accountability Act. There are some overarching credentials for the spa, and they can be, here it is, here's the International Spa Association, ISPA. They can choose to participate almost like a school can with accreditation. So that's kind of cool. And there's a way of behaving in the spa world, the wellness world. And so here's the expectations of that type of behavior. The spa environment is very sensory. So in this health and wellness setting, all of the senses should be addressed. So sight, sound, smell, touch. Um, the spa world brings all of those together, and the environment of the way the facility is designed and how it looks on the interior and the decorating of it, that's all part of the experience. Whereas in the sport and fitness world, for example, you might be performing massage in the middle of the locker room, or on the sidelines, or in the treatment room, or the environment is not an integral part of the experience. Where in the health and wellness spa environment, all of those things are an integral part of the experience and are very therapeutic. So this gives you a little bit of an idea around that. And you can have themes in the spa too. They can be culturally related. They can be around a particular modality approach. There's just targeting a particular demographic. There's just a lot that goes on in this model. So this goes on to explain massage therapy as part of this industry. And it gives you an idea of the pay scales within this environment, because typically this is an employee-based environment. So I refer you back to that explanation in Chapter 3. There's also a unique language here as well. And so this segment here is giving you some of that language so that you can understand what other occupations are doing within the environment. And then body treatments in general, some of them within the scope of practice of massage therapy, some more in the scope of an esthetician. That's also unique, kind of unique to this environment. Products, I already mentioned, the products are a big part of this world, especially skincare product. And then here, now, one of the things I don't like about the spa industry is it clings to the menu, the massage menu, which continues to separate massage from the idea of a therapeutic approach to achieve outcomes into a method. So, somebody might say, well, I want a classical massage because that's what they're used to. But what they're really after is they want a good night's sleep, or they might use the term deep muscle connective tissue massage when what they're saying is that they want the pressure to feel, what they really mean is they want the pressure to feel essential. So this dividing this up into menu items, I think, is detrimental. But it's sort of part of the environment, and to come to some sort of reconciliation on that, I think this is going to resolve itself, especially within the franchise structure. Franchise system's really moving away from this menu system, but a lot of the methods we discussed again in Chapter 12 will show up as menu items. If you are in a real spa, the hydrotherapy is a huge part of it. It's healing of the water. So hydrotherapy is sometimes difficult to incorporate into a smaller physical facility. And there's a lot of maintenance that's involved with it. And originally the spas were located near natural healing waters, where it was a sulfur spring or / mineral spring or a hot spring or whatever. And so like we have incorporated at our franchise, we have a dry sauna, and we have hot and cold packs and scrubs. And so those are the things that we have been able to easily implement out of the very rich, again, hydrotherapy approach. Sometimes there are very specific equipment that is used, and in the spa you'll have a wet room where they'll do some of these friction rubs that are then going to need to be washed off. And full body wraps, especially with some sort of mud or something, those are commonly found in the spa. Essential oils often are incorporated as part of that full sense experience. And so I refer you back to the discussions we had about safe application there. And then if you're going to think about cross-training, which I think is important, there are things that you can expand your information on. An esthetician, I think, is an excellent cross-train. Personal training in the larger spas that also focus on fitness, yoga teaching, again, in the larger spas. But I think the best cross-train is esthetician, because esthetician has some massage within its scope as well. Now, the figure here is just going to give you a graphic on, kind of a mock-up that we did in the studio when we did the photo shoot on kind of how a day at the spa would look like, and, kind of fun. All right, our next category is in the medical environment, and a development that I think is going to, it's rolling out slow, but I think it's going to make a big impact, is that the VA, Veterans Administration, as well as the Department of Defense, has opened itself up to integrative care, including and in particular, non-pharmaceutical approaches to stress management and pain. And in that environment also, mental health issues such as post-traumatic stress disorder. The big difference here is that there is typically some sort of condition involved. It can be multifaceted. There can be many aspects of that. And this is also a medical care team. So this is not a place that you're going to find autonomous practice like you can in the wellness industry. So inherent with that, there's usually a hierarchy or a chain of command. The clients tend to be a little bit more complex, so it's really nice to have other medical professionals there to give guidance and to manage some of the conditions or situations that can occur when you're dealing with fragile clients. There are medical treatments that you have to have an appreciation for. The massage itself is usually within the palliative category. Rarely is it in, especially in the acute care, is it in therapeutic change or condition management or restorative. It's almost always in the palliative category. Now, other medical care environments such as physical therapy, now you might be part of working towards recovery from an injury. So that would be more in the therapeutic change world, but you would not be doing that alone. You would be, again, part of a team. And there's a level of supervision in that. And this can become a challenge for some people because you do not have the same level of autonomous decision making in this kind of an environment. So while that's really cool to have that support, it also, some people can feel a little stifled by that. And so, you know, you need to know yourself with that. But there's no such thing as medical massage. And some people will use that term, oh, I do medical massage, or I do rehabilitative massage. And I get so frustrated by that, because massage is massage is massage. And depending on where the person is at, if they are in a situation or have symptomology where you think you need to call it medical, then they should be also being cared for under a larger umbrella of medical professionals, not autonomously alone. And then you get your crossover, particularly in stress management and pain management. It's because massage can do a wonderful job in a health and wellness setting, dealing with somebody that has chronic conditions, or in a medical setting outside of the acute care concept. And then you get chiropractic that fits into here too. And now see, I'm stumbling because it gets complex. So the assumption here is that there is some other medical professional more highly trained than the massage therapist that is involved in coordinating this care. And it's an interdisciplinary approach. So some of the information I just discussed here is outlined in the rest of this segment in the chapter. One of the other things that you'll find in this environment is that the massage is more targeted to an outcome. And in some of the spas, especially if the menu is in place, it's more around an experience. The value is in the experience itself. So there's a potential here also for massage to be part of the team that is being reimbursed through insurance, medical insurance. And you need a biller, you need somebody that's authorized to bill for those services. And then you're typically an employee in these settings as well. And this is not necessarily understood when somebody is saying, oh, I do medical massage. That confuses it. Uh, so this next segment in here talks to you about integrating into this team environment and the expectations around professionalism and the responsibilities that we have in terms of documentation and uh, reporting and sanitation compliance and all of that, all that are particular to that environment. So this is added learning. Much of this you've got, but the demands on using this information in the medical setting are going to increase. So it's likely that many people are going to be taking medications. So you got to stop and learn more about the interface between massage and medication here. It's accepted that there's some sort of pathology or condition involved. That the assessment, there's the massage specific assessment, but it's going to be built in and become part of a broader treatment plan. That infection is common in these environments. It's a common reason for people to seek medical care. And so sanitation procedures have to be stepped up. So these are the areas where there is likely to be an increased learning curve. So the idea of integrated care systems is getting traction, and it is very likely that some of you may move into an environment like that. And so a few years ago, there was some guidelines put together to measure the skill set and the best practices foundation for each of these common occupations that typically are involved in those kinds of settings. So acupuncture and oriental medicine, chiropractic, direct entry midwifery, massage therapy, and naturopath. So this segment here is giving you an overview of that information. And the VA, again, as I mentioned before, is really driving a lot of this forward. So you're going to want to investigate that further, and there's some links here and or search terms that you can use. The other thing that the VA did that's been very helpful, again, it's a slow rollout, but they actually came up with a job description within the medical setting, and they have a progression. So you start at an entry level, but then you, with more experience, more training, you can progress up into various, from massage therapist to trainer to department head. You can do that kind of thing. They put a pay scale in place, and it's very comparable to what was presented as pay scales and income potential in Chapter 3. It's well done. It's the model is there. Now it'll be interesting to see how other health or other medical systems use that model to integrate massage. So there you go. And I strongly suggest you take the extra time to look this up and absorb that information. So the pay scale structure, it's the VA established as in the health technician categorization that a massage therapist would have an entry point base, and they have government staggered pay scales. It's right about $15 an hour. And there were the massage communities, because they don't understand employment. It's getting better. They don't understand employment. They don't understand the idea of a salary. It's not, there's still too much emphasis on sole proprietorship and being a business owner and a massage therapist, and not understanding that in an employee situation, you only are the massage therapist. And in the VA structure, there's also benefits and stuff that go with it. So it's pretty dicey, but I do think that the VA established a very logical entry point, job description, and method of progression through there. So the Joint Commission, the opiate crisis fueled this, pain management, non-pharmaceutical use of complementary medicine to manage pain there's a concerted effort to get this integrated into the medical structure for treating these conditions. The problem is finances. So I think things like yoga are going to get better acceptance, even though it does not have as much evidence. And in the medical setting, evidence-informed practice is considered a benchmark. But a yoga teacher can see a group of people at about the same expenditure as a massage therapist can see one person. So it's much more expensive. There's much more financial output by these medical establishments, these institutions, to have people see massage therapists than it is for them to be involved in a meditation group. So that's going to end up being probably a limitation. Because people are more compliant with massage because they like it, I think that may have some tendency to override that. We'll see. And this segment goes into talking about how massage tends to be integrated. And I've kind of been talking about that. So here are some of the key points that you can take from this discussion. We can't get out of this without talking about health/medical insurance, which in the United States is a mess. And in other countries that use these textbooks, like Canada and England and Scotland, and there's some sort of national health care in place. So I don't have a clue how this is going to wash out. I do strongly believe, it's my opinion, but I do strongly believe that this will not, third-party payment of massage services will not be the norm. That it will remain out of pocket, and there might be something like a health savings account that can be authorized for wellness and prevention care. Now, I think there's potential there that people can use pre-tax dollars to pay for services like that. I would like to see that explored and developed. Certainly, if you're an employee of a medical group, a medical environment, they are going to pay you regardless of where the money comes from, whether the person pays, the client, patient pays for it themselves, or if insurance pays for it. So there's a real advantage to being an employee in these settings, because you as an individual don't have to wrestle with trying to navigate this medical insurance system. You do have to have excellent record keeping skills, and they have to follow, if you're in an insurance environment where insurance is going to be part of the compensation, you absolutely have to follow the documentation requirements that support insurance billing. And almost all these systems, I'd like to say all, have gone to electronic data collection. So you have to know that. And you're going to have to understand all of the HIPAA compliance. Now, when you go into an environment like that as an employee, you will find that you should have an orientation and training on how to be HIPAA compliant and how the notes are documented and what the confidentiality is and all of that. You should have precise training from that environment. You also have to have an increased knowledge of pharmacology, but you have to have this anyway, in the health and wellness setting and in the sports setting as well. But there is an assumption that if somebody's in the medical setting, there is a strong likelihood that part of their treatment is pharmacological. The medication is part of it. So this gives you a general reminder of how medication works, and this is where Medline Plus comes in so handy, because you can search for a medication there, and you also can see what the side effects are, and so you can be part of monitoring how well a person's doing. And then if you were to identify that they say they have a rash and they didn't notice it, then you can be part of the referral network. So the medical care system is trying to figure out how to also be actually healthcare. And the salutogenic model that was presented earlier in the textbook is an important part of all of this. And there is an increasing awareness of wanting to overlap in and expand the true idea of health and wellness prevention along with medical care. And both are important, and they overlap and they support each other. I would be dead if it wasn't for a skilled surgeon. And I wouldn't have even known I needed heart surgery if it wasn't for a skilled medical doctor. So I just, sometimes when we're considered in these alternative health practices or whatever, we look at medical practices and we think they're wrong, and they're not. If they are implemented appropriately. And it's not always the medical professional, it's the patient, it's the client that doesn't want to do their own part of the work. They don't want to exercise, they don't want to modulate their diet, they want a pill. And so I'm very understanding about the stresses and the strains and the demands in the medical environment. So this small segment tries to bring that awareness to you. And then cross-training recommendations. What the medical environment needs to know is that you know how to behave yourself in that environment. And so either EMT training or the one I most recommend is CNA, Certified Nursing Assistant. You may not practice being a certified nursing assistant, but if you have that, then the people that are hiring in the medical setting are going to know you know how to behave in that setting. So there you go. And then finally, the sport and fitness world. And this is where, in addition to autonomous practice, self-employed my whole career, this is where I have also functioned and worked primarily with professional sports. So I've lived this, and it certainly is not as glamorous as people might think. In the massage world, unfortunately, if you work with a professional athlete, you're considered to have status, and that really frustrates me. That also occurs in the medical world. If you work in a hospital, that's considered to have status, more status than working in a spa, which is really unfortunate. So this whole chapter weaves into the problems we have with professional identity. Now, the uniqueness of this environment is you're working with athletes that have performance demand, and you need to understand what that is like. You can work as an employee in these environments. That is increasing. But usually you're a sole practitioner and have clients who are athletes here. So if you are employed in these environments, it would be very similar to being part of a medical system. And you would be within the medical department. But often an individual athlete will have hired you as their massage therapist. And so it's a little less clear cut as far as the business end on here. So again, I refer you back to the business chapter as you kind of sort through this part of the career pathway in sport and fitness. In this arena, you're going to have probably more exposure to musculoskeletal injury and wear and tear. But the best thing we have to offer is not the whole idea of rehabilitative massage or orthopedic massage or any of that kind of stuff. That's not what we offer. It's restorative. It's massage in that restorative category with the whole outcome, relaxation, stress management, pain management, and functional mobility. So it gets very complicated. So there is experience and practice parameters. It's a complex environment to work. Originally, when this idea of sports massage was pulled together, the AMTA did it as a public relations campaign. And so they came up with massage at a sporting event in order for the public to see us working. And they came up with some little certifications around that that has since gone, it's dissipated now. But I think it's important for you to realize that this was set up as advertising and marketing. And it was pretty good. However, it focused more on amateur athletes, and it was primarily voluntary. And so that was not it fit for an individual therapist in terms of their own personal marketing and advertising, because they could hand out promotional material. But this whole idea of sporting events as a practice option, this is really kind of dissipated, but it still will show up as categories of practice or type of care or whatever on the MBLEX exam. So you're going to want to know a little bit about what this is. You know, what's a post-event massage and what's inter-competition and what's pre-event, and you know what those terms are and what they mean. And what it's like to be part of a sports massage team, which again this is here because it still shows up on the exams, but in actual practical application, this is not happening very much. So, so if you want to work in this arena, you've got to be well-versed in critical thinking, and you have to be able to function to achieve all of the outcomes integrated together. So you're gonna work with a person who wants their functional ability. You're gonna work with a person who may be in pain from overexertion, that is trying to recover, that has the mental stress and strains of competition, and is not sleeping very well and needs to relax. They might also be taking a variety of supplements and products that's common in the sports world, you know, performance enhancement sorts of things. They are not doing this for health and wellness. It's really about performance, and so they will often overdo stuff. My cat this is Smokey. Smokey's being very persuasive on being petted right now. So there is quite a learning curve, and professional athletes and anybody that's in performance, it could be a musician, they're actually quite fragile. You have to be confident that you're not going to interfere with their ability to perform. So this is this pretty complex career pathway, and it's made even more difficult because this is the cat again, just pushing the computer over. It's more difficult because you can be operating autonomously by yourself. It's always been much more satisfying and much easier for me in this environment. Smokey, say hi. Hi. Okay, go away. This environment, when I can collaborate and work with the athletic trainers and the strength and conditioning coaches and so forth. So, and then here are some cross-training recommendations here for you. Personal trainer is one. that especially if you're working outside of this professional sports arena, and in, like in a physical fitness facility, that's a nice cross train. Personal trainers don't necessarily function very well with strength and conditioning coaches that have their degrees, and with athletic trainers that are also degreed medical professionals. They overstep their bounds. And in all of these career environments, we need to know how to stay in our lane and respect all of the trained professionals within the environment, and learn how to enhance each other's benefits as opposed to competing or overriding or creating conflict. So, career pathways. And I would encourage you to visit and talk with other professionals in this arena. See what you'd like. You're gonna, at Health Merchant Center, you're gonna get an experience with the franchise industry, and because Luke and I both have worked in the professional sports world and with professional teams, we can give you a really good idea of what that's like. And Luke also worked, as I have, within the medical setting, and worked with people that have had joint replacements and that sort of thing. And I worked a long time within mental health too. So we'll be able to give you a pretty good overview of how this all will lay out to help you get an idea of how you want your career to advance. And then here are the questions, which you know what to do with. And we also have our situation in this chapter where for some reason, and maybe to your advantage, the answers and rationales were not moved to evolve, and so they are right here in the book for you, along with the workbook. And you can also find this on Canvas, which is where we've loaded all your Evolve resources. Okay. The next chapter we will look at is how we take our massage skill set and we consider unique, specific application for those that have maybe some unique circumstances. And that is another area that you can pursue for a specialization as well, is working with a particular population. So there we go. And remember, your career will evolve, and allow it to do that. Don't get stuck, and know that with experience and over time, these things become much more blended than they are separate. Okay, I am taking Smokey here, and she is just tired of me being on the computer, and she's waving bye-bye with her tail, and we are going to end this.